From Dr. Westman and myself, welcome once again. We wanted to chat with you today about something that is, I think, a very, very good topic to talk about. So Dr. Westman, as we all know, has treated over 10,000 people in his clinic. And when we talk about a keto diet or a low-carb diet, we always associate that with the major illnesses like type 2 diabetes and metabolic syndrome. But what about some of the other conditions that are maybe lower down on the totem pole that are just unbelievable? They work so well with a keto or a low-carb diet, but they never really get any mention. So I think today's conversation is going to be, we're going to choose maybe the top three conditions that a keto diet or a low-carb diet is really, really useful for. And I think to kick it off, I'd like to speak about something that a very good friend of mine has, and I know that he would watch this video and he will be able to get some great information from you, and that is a condition called psoriasis, which is a skin condition. Can you just give us a little bit of information, what you see in your clinic, and what sort of help a keto diet can give?
Yeah, well, so first I should mention we don't talk about these a lot because we don't have big research publications to point to. I like to keep my public conversations into the scientific realm, and so, but it does cry out for sort of a case series or maybe even survey of Facebook, which is a good way to get information out. And we've done that before for other conditions. But psoriasis, a skin condition that can be quite disfiguring and quite uncomfortable because it can cause itching, is something that gets better pretty reliably. Psoriasis is a inflammation that affects the skin, and it may even be autoimmune, which means your body is attacking your own skin. And so a keto diet or low-carb diet, because it reduces the sugars and starches and reduces the inflammation, is also good at reducing inflammatory conditions like psoriasis.
So if you were to see, let's say 10 people came into your clinic and they all presented with psoriasis, and they implemented the keto diet or low-carb diet, to the letter, what sort of success rate would you see?
I would say 10 in a row, so 8 out of 10 would show improvement, if not total resolution. So it's not everyone, but just about everyone.
And what sort of time frame would you see this in?
Yeah, it's not the kind of thing that will go away overnight. It can take, I would say, days to weeks for the inflammation to go down and the skin to heal itself again. So this is one of those conditions that takes some time. In fact, I would probably give it a month, a good trial of a lower carb or keto diet to see if your psoriasis improves or gets better on it.
Have you ever seen or heard any other, in your 20 years of doing this, have you ever seen any other doctors specifically treating this kind of a condition using this kind of approach? Or have you ever read about it? Or, like, for example, childhood epilepsy has been in the medical books for the last 100 and something years. Have you ever seen something like this before? Or is this something that is just no one ever speaks about?
I think there are some dermatologists who have written books about cutting out sugar in the diet as being good for the skin. And so it might be in there, but in the general medical mainstream teaching, no, it's the usual situation where we're taught to use medications rather than lifestyle change to treat it. So you might be getting the recommendation to take a medication for the psoriasis instead of the diet change, and it's just because they don't know that it can be very helpful.
And while we're just on that topic, I know that we're speaking about psoriasis, but what about other skin conditions? Eczema, just briefly.
Yeah, sure.
Does that improve?
Eczema improves, acne. I was taught by a professor of dermatology that there are societies around the world that don't have sugar, and the children who are teenagers don't get acne. They don't get pimples. I thought that was just kind of part of growing up.
Do you know that if kids got to watch this video and they could really try it and see that they would, I promise you, every kid would be on a low carb or keto diet.
Well, are you sure? I mean, sugar or not having?
No, I think the pimples are a big one.
Okay.
I think the pimples are a big one. So great. So that's the first one. Something that we spoke about as well that is very, very common in your clinic, and that is heartburn. Do you want to give us some insight into that?
Yeah, being common, I can almost expect half or more of my patients coming in on a heartburn medicine. These are the proton pump inhibitors or the H2 blockers, or even people taking Tums or Rolaids, some antacids every now and then, and that gets better 100%. So it may take a week or two, but this is one of those unknown, and if I mention everything gets better, no one will believe me, so I don't always mention that the heartburn will get better, unless that's a big complaint or problem that someone has.
Are they coming into you specifically
for it?
Okay.
Yeah.
And then I know that, as always, and you're pretty strict about this, you always mention that people should, when they implement this type of program and they're on medications for diabetes, that they should do this in consultation with a doctor because the medications become too strong. Right. Is this a case with regards to some of the medications that you just mentioned now for heartburn or not?
No, I don't have the same concern. I'm concerned about diabetes and high blood pressure medicines because they can become too strong and then you can feel sick as a result of it. The heartburn medicine or the antacids, every now and then you can just stop them without any problem. So I'm not worried about people stopping their own medicine like that.
Okay, fantastic. Yeah. So far we've gone through two, and I think that would be very, very useful to a lot of people. How about the third common condition that you might see that a keto diet really, really helps?
So we've talked about skin, we've talked about the GI tract, the lungs. So asthma is an under-recognized yet very common thing that gets better when you do a keto diet. A lot of children are raised with these inhalers and they use them and then they become adults and still use the inhalers, and that's a very common thing that will go away. We think it's because the less carbs you have, the less inflammation you have in the body. So you lower the inflammation, and then as you lose weight, you get more of a capacity for your lungs to inhale. So any lung condition that's restricted, including asthma, will improve as you lose weight, however you do it. And on a keto diet, because it has less inflammation going into the body.
So you're actually getting a two-part kind of help there. You're getting, because the lungs are being freed up.
A 1-2 punch.
1-2 punch, as well as the inflammation.
Yeah.
And again, what sort of success rate would you see? Let's say 10 people come into your clinic and they have mild asthma. And what about severe asthma? Does it help severe asthma?
Well, severe asthma, it can. I can remember a couple of patients just off the top of my head who had an exacerbation, meaning they couldn't breathe using inhalers, and then that improved, or went away, actually. The mild asthma, I would say it's in that 8 out of 10 category where just about everyone will have improvement, and some people will have total resolution of the asthma.
So they get off their medications completely?
Yeah.
Okay. Well, that is absolutely unbelievable to know. I think that it's very, very important that we share these type of videos with regards to some of the lesser known or lesser spoken about conditions. If you found these videos helpful, as always, please, we encourage you to share them. We are trying to reach as many people as we possibly can to share this message. And from myself and Dr. Westman, we appreciate all of your support. And Dr. Westman, thank you very much.
Thank you.